friends, it's Kimberly again here, Specialty Care Management. Glad you're here. Today, we're going to take you through another quick assessment and a fantastic tool for you. If you did the minute for your kidneys and you find that, I do have a risk for kidney disease, well, the next question should be, I wonder what that risk is and how am I doing? So your nurse coach will go through your labs with you. And so if you have a copy of your labs handy, when she calls, you'll go through that with her. If you don't have a copy of your labs, simply call your doctor's office, ask for a copy. Now, we're happy to call your physician for you and get a copy of your last few sets of labs for you, and we'll go through those together. But it will be incredibly more meaningful to you to be able to look at those yourself with the nurse, right? So the goal is that we want to be sure that next year, 5 years, long after your participation in this program has ended, that you still have value from the time that you've spent with us. We really want to be meaningful and be able to serve you. And one of the best ways that we can do that is to help make sure that you know for yourself what things you should be watching out for and what kind of questions you should be asking your doctor. So let's go through this tool. Let me share a screen again with you. This site that we're going to be working through today is called kidneyfailurerisk.com. So if you have a risk for kidney disease, like I said, your next question most likely is going to be, what is that risk? So just because you have a risk for kidney disease doesn't necessarily mean that you're going to end up with kidney disease. And just because you have kidney disease does not mean you're going to end up on dialysis, right? Truly, people with kidney disease, very, very few of them end up on dialysis. That being said, it's not that it's uncommon. The goal, again, of this program is to help you identify where your risk is, what you can do to change that and lessen that risk so that that isn't something that's in your future. Or if it is going to be in your future, we want to make sure that you control that ride, right? So that you have the most power and you can really, truly live life on your terms. So one of the ways that we do that is by looking where we are. It's really hard. So I'm going to tell you, I can drive great blindfolded, right? It works fantastic until I hit a tree, right? So not knowing, not seeing that a tree is in the middle of the road isn't going to make my crash hurt any less, right? It's a whole lot better for me to uncover my eyeballs so that I can see where I'm at. That way I can determine if I want to turn right or left. Maybe I want to slow down or reverse. Hard for me to decide what I need to do unless I see where I am. And that's what this tool is going to give us. So if we go ahead and you can do this with me if you have your copy of your labs with you. So this is kidneyfailurerisk.com. And so let's just work through this together. And let's say maybe my age, let's say I am 52. And let's put in here that I'm a male in North America. And if I look at my labs, and let's look at this together. So when you first look at your labs, we're going to use this as an example. When you look at your metabolic panel, that's the lab that you're looking for to find your kidney filtration rate, or GFR. We'll go through this in another video, but in general, the GFR is the lab that's going to tell you how fast your kidneys are filtering. And so what you see here, you'll know that you're on the right page when you see things like this. You'll see sodium, potassium, you'll see glucose on there, creatinine. Know that the GFR is derived from the creatinine. It's an estimate. So this eGFR stands for estimated glomerular filtration rate. That's because it's derived from the serum creatinine. Creatinine is a byproduct of muscle metabolism, and creatinine passes through the filters in the kidneys largely unchanged. So this is why we use this in our equation. So basically what we have here, if we look, let's look at the GFR for non-African American. So sometimes you'll see this written as eGFR, sometimes you'll see it as glom fill rate, sometimes it'll just be GFR. Sometimes it'll say non-AA and AA for non-African American and African American. Now keep in mind, a couple years ago, this is slowly being done away with, which is fantastic. And so you know, your lab may not differentiate between AA and non-AA. That's fantastic. If it does, let's just work with a non-African American. You can see here you get a lower amount, and it's likely more realistic. So this is the one we're going to use. If this says this on your lab result, if it doesn't, sometimes you'll look here and this will only say greater than 60. Remember back in school, the greater than, lesser than sign? If you've got the greater than sign and then greater than 60, then all that means is that you don't have stage 3 kidney disease, right? Doesn't really tell you where you are, where you've been. So if yours just is greater than 60, you're going to look to the creatinine. And if you type in GFR calculator, I like the one from the National Kidney Foundation. Okay, and you can, if we go back to this example, and we look at the creatinine here, 0.68. Let's go ahead and put that in here, 0.68. Okay, and we put in our age. I forgot how old I said I was. I think I said it's 52. Yes, no, okay, calculate. And this will give us a GFR of 112. Well, that's quite a bit different, isn't it? That's interesting. That's really interesting. Because here, this has me at 88. Look at that. So you can see now why it's kind of mysterious. That's just, I find that really interesting. Of course, I don't know how old this person was, so that may account for that. Just know that there are multiple factors that go into that equation. Actually, it's kind of a long equation that we use, but and age and sex and race play into that, or race used to play into that, and now it doesn't. So anyway, if this was the case, then we would go in and we could plug in the GFR of 112. Okay, so we're going to go off of our lab slip. If you have your lab slip, go ahead and use that one. So here we're going to say my GFR was 88. And actually, I'm going to change that so you can see. But 88, it's kind of like, remember back in school? Actually, let's just roll with that one, and we'll do a different example. Let's say our GFR is 88, and urine albumin to creatinine ratio. So this sounds complicated. Really, what this is a measurement of how much protein is spilling in the urine. So it's really important when you go in for your yearly labs, make sure that you're peeing in the cup. If the doctor doesn't give you a cup to pee in, you want to ask him, especially if you have diabetes or heart disease or high blood pressure or cholesterol or anything, and you're not peeing in a cup every year, you're being shortchanged. So make sure that you want to ask, hey, I want to know, am I spilling any protein in my urine? It's not an expensive study at all to pee in a cup and check for at least to see if you're spilling any protein. The urine albumin to creatinine ratio, this actually measures how much basically albumin is baby protein. And what this lab is looking for is a measure of microalbuminuria, basically to tell if you've got any little bitty protein strands spilling over in the urine. And you can see here, if you hover on the question mark, it explains what this lab is. So let's just go in here. Normally, we like to see this less than 30. So let's just say mine is, let's say mine is 12, not much at all. Okay, and we click next. Now, if I have other labs like bicarb, calcium, phosphorus, these are all measures that will be important if you have kidney disease. Those are fantastic. And let's see here, with what I've put in with a GFR of 88 and really not spilling any protein in the urine, you can see here I don't have a risk for kidney disease and certainly don't have a risk of progressing to kidney failure, right? So if you got a score like this, barring anything crazy in your medical history, maybe you don't need the program. So I would definitely share that with the nurse coach. And then the goal would be, depending on, of course, the comorbid conditions, right? Depending on if you have diabetes or high blood pressure or weight issues, then the question is going to be, let's circle back in 6 months to a year and make sure that nothing has changed. Okay. So let's look at another example. If we go back here, whoops. And let's look at an example that I see quite often. There's a great video on this site too that introduces you to the study. This was actually developed. The CDC also has a kidney failure risk, an equation that's a little less specific, which is why we really like using this tool. But let's go in and let's use another example. Let's say I am, what did I say, 53, 54, let's say I'm 55. And let's say I'm a male in North America. Now let's say I look at my GFR, I find my GFR, and let's say my GFR is 26. And let's say I am spilling some protein in the urine. Let's say my urine albumin to creatinine ratio is 36. And your nurse will help you with this. Okay, and let's say I don't have those things again. Now we can see here that according to these labs, my labs are consistent with stage 4 kidney disease. And what we see here is that my risk for progressing to dialysis or transplant in the next 2 to 5 years is somewhere between almost 6 and 17. Anything over 10 is considered a high risk. And certainly there are things that we can do to protect our kidney function so it doesn't decline. But if I look at this here, this means at 5 years, I'm likely to have a very high risk to progress to dialysis in the next 5 years. And if we go through, if you do go through these steps and you find that you do have a high risk, then certainly this is where, working with your nurse coach is going to be really important. And it's going to give you some tips in terms of what you can do to help protect your kidneys. Also, these are the very same things that your nurse is going to go through with you, but in particular to your specific situation. So keep in mind that, if you do check your risk and you do have a high risk for kidney disease, you absolutely can decrease your risk and protect your kidney function. And you can absolutely minimize your risk of progressing to kidney disease. We've worked with lots of people all across the country, many people who are on the verge of dialysis. So keep in mind, there are 5 stages of kidney disease, right, before people get to dialysis. The normal GFR, normal kidney function, the GFR is above 90. If yours is below 90, but above 60, that does not necessarily mean that you have kidney disease. What it means is that if you have a diagnosis of kidney disease, then you would be in the early stages, stage 1 or 2. Many people are not diagnosed until that GFR falls under 60, at which point that would be consistent with stage 3 kidney disease. Once the GFR falls under 30, that's stage 4 kidney disease. When you hit stage 4 kidney disease, you're on that trajectory to dialysis. And without intervention, it's highly likely that you will at some point progress to dialysis. Intervention at that point is really important to help look at what are the risk factors that have brought you to this point. What can we do to reverse that? I've worked with many people who are right there. I've worked with folks who are as low as 15, 17% of their kidney function. That's a GFR, say 15 to 17. And working with the nurses, they've been able to sometimes double their kidney function. That would be taking you from a late stage 4 kidney disease and bumping you up to a stage 3 kidney disease. Many people at stage 3 never progress to dialysis, particularly if you're mitigating or reducing some of those risk factors that are causing the kidney damage, right? If I'm tearing up the filters in my kidneys because my pressure is too high, when I take the pressure off, that absolutely is going to help reduce the risk that my kidneys are faced with every day, right? If the reason I've developed kidney disease is because my sugars are too high and that's tearing them up, we're going to talk a lot about why these things play into our risk for kidney disease. And they're absolutely reversible factors and factors that you have complete control over. And so if you do evaluate your risk, or you look at this with the nurse and you find that you are at a high risk for kidney disease or a high risk for dialysis, please don't get worried, because we can absolutely, that's our specialty, is helping you reverse that, slow that down, stop the progression. Or if dialysis is going to be inevitable for you, how do we make that so that you can live a glorious, rich, and full life on dialysis? And we've been doing that for a long time. And it really is a pleasure and an honor to help you live life on your terms. If it were my turn, that's certainly what I would want for myself and my family. So with that, I'm going to let you explore the site and make sure that if you haven't yet talked to your nurse coach, this is a perfect time to pick up the phone, give us a call, or you can even reach out on the Get Healthy platform. You can send a chat that will go right to your nurse. Know that anything that we put in the chat is confidential. It's a secure site so that your information is absolutely protected and a safe way for you to share information with your nurse. We look forward to speaking with you and helping you live your very best life. In the meantime,